Beach at 3:30 in the morning. Yep, and it's not a rave. We'll have the details. Sky Channel 83 if you'd like to watch us. Freeview Channel 50.
RNZ News at 5. Kia ora, I'm Marama Tipole. The Prime Minister is asking police to clarify the criteria for dairies receiving fog cannons. The Auckland dairy, where worker Javak Patel was killed on Wednesday night, had applied for fog cannons twice, but was denied both times. A number of dairies across Auckland say they were told by police they'd only be eligible if they were ram-raided first. Jacinda Ardern says that is not the case, and the criteria in the past have been much broader. She says 1,000 fog cannons have been installed since 2018. Meanwhile, retailer workers are demanding better protection from the government. Dairy and Business Owners Group Chair Sunny Kashau is organising a nationwide protest to be held after the funeral for Javak Patel.
We do not need the empathy from the government. We don't want any more statements, and the time for talks is over. We need action, and the action is to stop this senseless crime, and we need the assurity from this government for the safety of the businesses and average New Zealander.
Sunny Kashau says thousands of dairies and small businesses will shut for a minimum of 2 hours as a mark of respect and protest. The head of a medical union says the refusal by the Health Minister to label staff shortages a crisis is making workers feel unheard. Andrew Little addressed the Association of Salaried Medical Specialists annual conference in Wellington this morning. Medical workers spoke of 10-hour waits in emergency departments, assessing patients in corridors and ambulances queued up on admission ramps. The association's executive director, Sarah Dalton, says there is some frustration with the minister's big picture, long-term approach. The mother of murdered woman Nicole Tuxford says sitting through the inquest into her daughter's death is the hardest thing she's done. Paul Tainui raped and murdered Ms Tuxford in 2018 while on life parole for the 1994 murder of Kimberly Schroeder. A joint inquest into Ms Tuxford's death and the suspected suicide of Gary Schroeder, Kimberly's father, adjourned in Christchurch today. Sheree Gillett has sat in court with her daughter's ashes during the past 2 weeks.
It's the hardest thing I've had to do. But she had to be there. She had to be part of it because we needed answers for her. To show them, she's a person.
A Gore District Councillor has rubbished claims from the new Deputy Mayor that a move to oust him is motivated by loyalty to the previous Mayor. Gore's new Mayor, Ben Bell, has selected second-term councillor Stuart McDonnell as his deputy. Mr Bell, a 23-year-old, beat sixth-term incumbent Tracy Hicks by just 8 votes. A majority of councillors are calling for his chosen deputy to go, which Stuart McDonnell says is motivated by loyalty to Mr Hicks. But Councillor Neville Phillips says that's wrong and his only concern is Gore. Legislation giving the Commerce Commission the power to investigate and set fuel prices has passed its first reading in Parliament. The government says the Fuel Industry Amendment Bill will allow the watchdog to take real action if it suspects anti-competitive behaviour. Priyanka Radhakrishnan, who introduced the bill on behalf of the Minister of Energy and Resources, says it builds on earlier legislation which made it easier for low-price retailers to get into new markets.
Now is the right time to introduce this important feature to give consumers confidence during a time of high pricing volatility that increases in fuel prices are not being driven by unreasonably high margins.
Auckland University of Technology says 170 academic staff will be made redundant to balance financial losses from a lack of international students. The university has confirmed to RNZ that following an 11-week consultation, a number of staff were told on Wednesday their positions are surplus to requirements. They've been offered voluntary redundancy, but those who refuse will learn their fate next week. It's 4 minutes past 5. In sport, the opening one-day cricket international between New Zealand and India in Auckland is evenly poised after India got off to a flying start. Having won the toss and opted to bowl, the Black Caps found themselves on the back foot with India openers enjoying an opening stand of 124 before the first wicket fell. Tim Southee grabbed New Zealand's second wicket, bringing up his 200th in one-day internationals, with India a short time ago 160 for 4 in the 33rd over.
Gone! Southee international cricket, Shikhar Dhawan departs. Perfect, Tim Southey. Great length again. Shikhar Dhawan looking to push forward straight to Finn Allen.
Southey is the fifth New Zealand bowler to take 200 ODI wickets. And just days after being released from his New Zealand cricket contract, Martin Guptill has signed with the Melbourne Renegades in the Big Bash League. Five-time champions Brazil have outclassed Serbia 2-0 in their Football World Cup opener in Qatar. Portugal's Cristiano Ronaldo has become the first man to score a goal in 5 World Cups as his side beat Ghana 3-2. Switzerland beat Cameroon 1-0 while Uruguay and South Korea drew 0-0. And Dan Hillier is the best placed of the New Zealand contingent after the second round of the Australian PGA Golf Championship in Queensland. Hillier is tied for 8th at 6 under par, 4 shots off the lead. That's the news.
Tomorrow morning, Irish writer Colin Toybeen. He has a new essay collection, A Guest at the Feast. Something Boris Pasternak said, I think. Fatboy Slim, DJ legend, one of the godfathers of dance music. And the New Zealand neurologist studying the effect of diet on cancer and Parkinson's disease. Ko Kimihilaho, join me tomorrow morning from 8 on RNZ National.
RNZ National funded through New Zealand On Air. Lisa Owen and Checkpoint is next. Right now, the short forecast from Met Service to midnight Saturday. For Northland, a few showers, possibly heavy. In Auckland, fine, apart from isolated afternoon and evening showers. Waikato to Whanganui, including the Central High Country. Cloudy periods with scattered showers easing for a time tonight. Manawatu to Wellington, mainly fine today with isolated showers. Cloudy periods tomorrow with showers north of Kapiti Coast. Bay of Plenty, Gisborne, Hawke's Bay and Wairarapa, also Marlborough and Nelson, fine apart from isolated afternoon and evening showers. Bulla and Westland, isolated showers today, rain for tomorrow, easing in Bulla and South Westland in the evening. For Canterbury, partly cloudy, isolated afternoon and evening showers, possibly heavy and thundery in the south tomorrow. For Otago, Southland and Fiordland, occasional showers, possibly heavy, easing this evening. Showers returning tomorrow, possibly heavy in Otago later. And for the Chatham Islands, occasional showers, some heavy and possibly thundery until this evening, and mainly fine tomorrow. It's 7 minutes past 5.
Nā mihi eho, tēnā koutou katoa, nau mai haere mai ki Checkpoint e tēnei rā, ko Lisa Owen tēnei. Andrew Little has faced the wrath of medical specialists who have vented their frustrations about overwhelming demand compounded by underpay and understaffing. The Health Minister was met with a barrage of angry specialists who didn't pull any punches, describing the pressures and stress of working through 3 years of COVID. But there was little comfort for those attending the Association of Salaried Medical Specialists annual conference as the Health Minister repeated messages they've all heard before. Our reporter Kate Green and visual journalist Angus Drever have the story.
Healthcare workers spoke despairingly of 10-hour waits in emergency departments, assessing patients in corridors, and ambulances tied up for hours as they wait for patients to be admitted. Healthcare professionals say the workforce is at breaking point.
How do you expect people to be engaged when we start each shift on the soul-destroying premise of 40 to 50 patients waiting to be seen, already been there for 8 to 10 hours, 15 nurses short, several doctors short, and most of the beds in the ED full of patients who are boarding, waiting to go up to the ward?
The ASMS has calculated it's going to take somewhere like 100 years for the gap between Māori and non-Māori to achieve parity. I don't know that we have 100 years.
Staff who are being routinely, weekly, being asked to work extra shifts to undertake additional duties and are being refused payment as a right.
How do we look after the staff that are currently working their asses off?
And still there's a word the Minister has been avoiding.
When are you going to acknowledge that New Zealand is in a healthcare crisis?
I've repeatedly acknowledged the incredibly challenging circumstances that we're in, and we are. I think the challenge for me is to work with the people I have to work alongside to address those challenges and to find the fixes to the problems.
The Minister says a ferocious winter on top of a pandemic highlighted the pre-existing issues within the system.
Even before COVID, the health system was facing major challenges because of funding or a lack of it, and a failure of funding to keep pace with population growth, amongst other things. So when I say amongst other things, a range of things that funding simply wasn't dealing with even before we got to 2020.
Sylvia Boyes, an emergency physician at Middlemore Hospital, has asked the Minister what the plan is in the short term. The Minister says patients need to expect to wait, and health organisations need to shuffle staff around within hospitals to spread the load. But that's going to be harder if the research is correct. Andrew Robinson, a Rotorua anaesthetist, says the union's research shows 1 in 10 doctors are looking to leave New Zealand permanently. Occupational physician Dr Alexandra Mutu, whose specialty is caring for the health and well-being of medical staff, says people are burnt out.
People are coming into my office who are incredibly resilient, incredibly competent, giving out all the time, and they cry and they have a sense of moral injury that they can't do what they know they should be able to do for their patients. So many people are looking at leaving.
Alexandra Mutu wants to see Te Whatu Ora commit to having an occupational physician on the executive team to better care for the health of the workforce themselves.
Meanwhile, doctors at a West Auckland clinic say patients are facing increased wait times for appointments or being turned away altogether as the number of GPs in New Zealand stagnates. The situation hasn't improved since Checkpoint reported on the issue in June, with half the country's primary care practices currently unable to take on any new patients. Reporter Tom Taylor and camera operator Nick Monroe have the story.
Hobsonville family doctors haven't accepted new enrolments for 2.5 years. Reaching capacity with 7,400 patients, they're among the 50% of primary care practices in West Auckland that have closed their books. But Dr Torrance Merkel says it's a last resort.
We would love to take more patients, but we can't do that when the patients already have a waiting 4 to 5 days for an appointment.
Closing the books just before the pandemic, the practice reopened them at the end of 2020, but was inundated with 400 enrolments in the space of 2 months and had to close them again. As the population of Hobsonville swelled, the practice set up a brand new wing that could accommodate 2,000 new patients. But they've been renting the space out as they can't find enough staff to work in it. They're having enough trouble just retaining the staff they have.
Over the last 2 years, last year we had 1 GP retire and another GP moved back home to Europe. This year we lost a GP to Australia and then another GP moved to Tauranga.
Dr Paul Nichols joined the practice in 1988. He says a lot's changed since then.
We used to be able to see people the same day or the day after, pretty much I would say guaranteed.
Now, he says people are living with medical issues for longer, meaning more complex issues need addressing during short appointments.
We don't have a choice, we have to deal with it. You can't ignore it and ask them to go away for another week. So the result of that is that there's more in the way of staff burnout.
Dr Nichols, who is nearing retirement himself, says the only thing that'll lighten the load is more GPs. But while the government says it's increasing the number of trainees from 200 to 300 per annum, the workforce has only seen an increase of 15 GPs in the last year. And Hobsonville Family Doctors gets about 15 calls every week from people wanting to enrol.
Some people will take that as be totally affronted by a receptionist saying, "I'm sorry, we're not taking on new patients," because they will interpret that as, "Who are you to tell me I can't get medical care?" when really it's just that we don't have the capacity.
Of New Zealand's 1,200 general practices, about 600, or 50%, are open for enrolments, according to the HealthPoint website. Access to primary care is unevenly spread across the country. While West Auckland mirrors the national average, Wairarapa has just one of its 13 practices open to new patients. Dr Nichols says many people stay with their city doctor after relocating to the regions. He says this arrangement works, until it comes time to refer patients onwards.
We don't have any knowledge of who is down in Hamilton or Timaru or what specialist visit or which hospital they even go to. So it creates a lot of problems and delay for them.
Even within West Auckland, some patients are travelling well outside their neighbourhood for a checkup.
I go down to the old place I used to go to, which is Ratanui in Lincoln Road. And so I can get in there when I need to, that's not a problem. I've been trying to shift to the doctor upstairs for over a year, and no luck.
Others have noticed their local doctors facing more pressure.
I know at least 2 of the doctors have left the practice that I'm in. One's gone north to live, and the other one has gone on maternity leave. And I think they're having difficulty filling the places that are left.
If it's anything urgent, you need to go see someone else because you just can't get into your normal GP.
Health NZ's Primary Healthcare Improvement Manager Adeline Cummings says she's working closely with the Ministry of Health and Māori Health Authority on solutions to workforce shortages. She says the latest survey of general practices show 1 in 3 are not taking on new enrolments. But this number does not include accident, urgent care or independent clinics who might also enrol patients. Health NZ kicked off its first major international recruitment campaign this week, targeting health professionals in the UK, Ireland, Canada, the US and Singapore.
If you'd like to check out the video version of that story from Nick and Tom, we'll put it up on our web page. And we would love to hear from you. Text us on 2101, tweet us at checkpointrnz, or the email address is checkpoint@rnz.co.nz. How easy is it to get into your GP for an appointment? What is the wait time? Are you enrolled somewhere or are you having problems at stage 1, do let us know. It is almost 17 minutes after 5. Kia mau tunu mai, stay with us. You're listening to Checkpoint on RNZ National. A business leader says the time for talk is over and retail workers are demanding better protection following the death of a dairy worker in Auckland. A nationwide protest will be held after the funeral for Janak Patel, who was stabbed to death in Sandringham. Jonty Dine reports.
The Sandringham community's sadness has turned to anger.
Enough is enough. This is not New Zealand. This is not how it used to be.
Please do something. We're just begging the government. Please do something.
The chance of being able to live a normal life without violence like this is just abhorrent.
It's just a scum of the earth coming out, I guess.
Oh, it's scary for everyone.
I don't know what is to take from my dairy owner. Sugar, butter, flour. What could they possibly take from him?
Locals say they are living in fear.
I lived all my life in Sandringham. All my children, grandchildren are born. Great-grandchildren are all here. Now we've got to barricade ourselves in the own property. Why?
You think twice about walking around the neighbourhood now, especially on your own, and after the other 2 murders that happened earlier in the year.
We always were brought up with your doors were left open. Like anyone, kids running in and out of houses. I mean, that went long ago.
The family who owns the dairy are much loved.
Yeah, it's called the Pink Dairy. Everyone knows the Pink Dairy.
They're a beautiful, kind, hard-working family. It's just awful.
That family are quite a centre of this whole community. We all know them.
Yeah, totally. And they're so lovely. Yeah. They're so lovely.
Dairy and Business Owners Group Chair Sunny Korshall says the government must be responsible for providing safety to its citizens.
We do not need the empathy from the government. We don't want any more statements, and the time for talks is over. We need action, and the action is to stop this senseless crime.
Thousands of dairies and small businesses will shut up shop for a minimum of 2 hours following Mr Patel's funeral as a mark of respect and protest. Sandringham Business Association Chair Chetan Chittabomma says had the government listened to their pleas for protection, Mr Patel's death could have been avoided.
Sadness, frustration, anger, because we saw this coming. I myself uttered the words a few weeks ago, this will end up someone dying. This wasn't rocket science. We knew this was going to happen. They did not put the brakes on. They thought the perpetrators' so-called rights were more important than the retailers.
Vipra Patel, who owns a dairy in the suburb of Otahuhu, says she is calling police every day. She says she's ready to close her shop.
It's time, we need some sort of answers. It's enough is enough now, We don't want to lose any more now. It's so bad,
Shobana Ranchoji left the industry due to safety concerns.
18 years we've been in the dairy industry on Mount Eden Road, Chandra Superette, and it just got to a point when a dear friend got bashed by a baseball bat in his shop. He was doing nothing at all.
The people of Auckland want action.
We know with all this crime going on and the leniency everywhere for the criminals, it's not getting any better.
Well, there doesn't seem to be anything that's stopping it at the moment. And the escalation, is it copycat or is it just people getting angrier and angrier?
We want, more security and safety for the community and for everybody. Not we want some good answers from the local ministers also.
The Rose Cottage had applied for fog cannons twice, but was denied both times. A number of dairies across Auckland say they were told by police they would only be eligible if they were ram-rated first, but Jacinda Ardern says that is not the case.
That hasn't been the criteria for the fog cannons. That's why there's been 1,000 of them installed since 2018. So I would want to check in with the police as to why that message may be given, because certainly the criteria in the past has been much broader.
A Give a Little page has been created to fundraise for the family and help with funeral arrangements.
It is almost 21 minutes after 5 and you're with Checkpoints on RNZ National. Homai o whakaaro, we would love your feedback on anything you've heard on the program this evening. And also remember, coming up shortly will be Professor Michael Baker. He's joining us live to answer your COVID questions. Remembering they're forecasting potentially up to 11,000 cases a day over the summer period. We need some hints on how to stay clear of it. So text your questions in on 2101 and get in quick, or you can email us at checkpoint@rnz.co.nz. It's time to go to the headlines now. Ane Amarama, mena pitipita kōrero.
Whaftailava, thank you, Lisa. The Prime Minister is asking police to clarify the criteria for funding fog cannons for shops after some dairies were told they'd only be eligible if they'd already been ram-raided. The Auckland dairy where worker Javak Patel was killed on Wednesday had its applications rejected twice. Meanwhile, the dairy owners group is organising a nationwide protest to be held after the funeral for Javak Patel, calling for better protection from the government. The head of a medical union says the refusal by the Health Minister to label staff shortages a crisis is making workers feel unheard. Andrew Little addressed the Association of Salaried Medical Specialists annual conference in Wellington today. The association's executive director says there is frustration with the Minister's big picture, long-term approach when hospitals are struggling now. 170 academic staff at the Auckland University of Technology are to be made redundant to balance financial losses from a lack of international students. AUT says it emailed some staff on Wednesday, offering them the chance to take voluntary severance instead. And avian flu has wiped out more than 50 million birds in the United States this year, the deadliest outbreak in the country's history. The new variant of the disease has also been breaking records in European countries. In Britain, bird flu has forced most supermarkets to ration how many eggs customers can buy. It's 22 minutes past 5.
Ngā mihi marama. If you're jetting off somewhere this coming holiday season, spare a thought for aviation security when you pack your bag. In the past 8 months, it's had to remove 130,000 banned items from people's luggage, both carry-on and checked. Aviation Security Operations Group Manager Karen Irwin is the first to admit the rules are complicated.
The rules around dangerous goods and prohibited items is sort of like 6 inches thick. It is very, very complex. So we try and distill the guidance down to as simple a format as we can. So it's things like batteries. So batteries trick people all the time.
Let's stick with that for a second. Is this the most commonly removed item from luggage?
Absolutely, yes, it is. So it's the old lithium batteries, and it's like if you hold your cell phone when you've been talking on it up to your ear, if you've been talking on it for a while, you feel how hot it is, or if you've been using any kind of power tool that's got a lithium battery. Lithium batteries can get really hot, and every year fires start because of lithium batteries in houses as well as on planes. So that's why if you've got a lithium battery, it needs to be in your carry-on bag with you in the cabin. So if there is a problem, it can be immediately dealt with by the cabin crew.
On that subject of lithium batteries then, the cell phone is something that people might register Okay, but there are other things. What about if you've got AirPods?
Yep. So AirPods must travel with you in the cabin. And the one that really trips people up, and it's really terrible when we have to remove it from people's bags, are hearing aid charges. Because it must be terrible when people who use their hearing aids get to the other end and then find they've lost their charger.
Okay, so here's the thing. Some things are okay to go into the hold of the plane and other things you must have with you in your hand luggage. Here are some things that people are curious about. Lighters. Is it okay to take a lighter on the plane with you?
Yes, you can have one cigarette lighter with you, but if you have any more than that, then that's going to be removed from you.
With sharps, you've got to be careful about the size and length of the blade. And this is another question from our team. Aerosol deodorants, ones that you spray, where do those go?
Okay, so you can take aerosols with you in the cabin and in your hold stow bag, but they must have a lid. The other little trick here is, remember, the 100 ml rule applies. So you can't take a great big bottle of hairspray. So if you were planning on having a sort of an Ivanka Trump hairdo all the way through the flight with your giant bottle of hairspray, no. You need the small travel size, which is 100 ml or less.
Karen, this is making my head hurt. You have just clearly illustrated your point that it is complicated.
It is really complicated.
When I'm sitting on my suitcase trying to jam that final toothbrush and T-shirt in there and hauling the zip around, what should I be thinking? Where do I go to check this list?
So go to our website. So if you go onto the CAA website, there's loads of guidance there, pictures, the whole 9 yards. But there are some other things I just quickly note. International, of course, there are the rules around liquids and aerosols and gels. So that includes things like peanut butter, Marmite, butter, and every year we take tons of it off people. You cannot take it through a screening point.
And Karen, does it get destroyed? All of that stuff?
Sadly, all the food items, for obvious health and safety reasons, we do have to destroy it, which is really heartbreaking. But things like the endless supply of pocket knives and scissors and things like that, we actually donate to scout groups and kindergartens and all of those kind of things who are always needing scissors and things to, in their daily use. So we try and find a good home for those. And the other advice I'd give is that this year, the whole system is on some real strain. All of the border agencies, all of the airlines, the airport companies, we're all got staff shortages. It's all going to be pretty crunchy at Christmas time. So please get to the airport in plenty of time, whether that's domestic or international. You're going to need to be there for domestic at least an hour before your flight leaves.
And if you don't want the person behind you to get grumpy, make sure what you've got in your carry-on is what you're allowed.
Absolutely. I always say to people, dress like your 90-year-old granddad. Elastic waist, no belts. Don't wear shoes that have complicated laces and are hard to get on and off. Don't wear lots of jewellery. Don't wear things with lots of blingy metal bits and pieces all over them. So think about that kind of stuff too. You just want to be able to breeze through without us having to stop you for any reason.
And that is Aviation Security Operations Group Manager Karen Irwin. I don't know about you, but I learned a lot from that about what not to put in your carry-on and how to dress. Okay, the Black Caps in India have begun the one-day international cricket series in Auckland, following on from a rain-interrupted T20 series. The two sides will play 3 ODIs as they look towards next year's World Cup. Well, we're joined now by sports reporter Felicity Reid. What is the latest in cricket? This is Eden Park, isn't it?
It is Eden Park. So the rain that was hanging around Auckland this week has moved on, so they do expect to get a full game in. New Zealand won the toss and opted to bowl, so they've included 4 seamers and a spinner, which is a little bit of a different makeup to the squad than normal. Jimmy Neesham misses out because he's got a niggle. India have also made a few changes from their T20 squad to the ODI team. They've handed 2 players debuts, Arshdeep Singh and Umran Malik, and they've also switched up their bowling. But they actually got off to a very, very good start with the bat. They were actually, both their openers made half centuries and they made it through to 124 before they lost their first wicket. Then they also lost their second wicket. So Lockie Ferguson took that first wicket. Tim Southee took the second, and that was his 200th ODI career wickets. So fifth New Zealander
200th?
New Zealander to achieve that record. And then Ferguson after that also took 2 more wickets in an over, so it did put New Zealand in a slightly better position. A short time ago with 10 overs to go in the innings, India were 210 for 4. So that's going to be a decent total for the Black Caps to chase once they finally get out there. The small boundaries of Eden Park might help us out there though. And this series continues in Hamilton on Sunday, and they're actually playing for points for the World Cup for next year for qualifying.
Okay, and speaking of World Cup, there is another World Cup starting in Auckland this weekend. What is that one?
That one's the Softball World Cup.
Oh, okay.
So that's over on the North Shore, Auckland's North Shore at Rosedale Park. It's the top 12 teams, softball teams in the world have come to New Zealand. We're all playing for this title. That was the last time they played for it was 2019. So that was also the last time that the Black Sox played some international softball. So they're 7-time winners, but they've dropped to 6th in the world because of that lack of international play. So for them, they're trying for an 8th title in front of a home crowd, and it's the 4th time that this tournament's been held in New Zealand.
Yeah, that's an interesting one. I don't know much about it as a sport. Do lots of people play it in New Zealand? Do we know?
They're talking about the growth in it, and again, it's that drop-off of the traditional drop-off of the age of like the high school students. So a lot of younger children, and they also say that there can be the switch between softball and baseball when you're a younger kid, but once you get to the sort of more teenage or that, you sort of need to make a decision. A little bit harder in softball, maybe not the same kind of money or opportunities which you get overseas in baseball.
Yeah.
But I think there's some softball diehards, and as they say in New Zealand, it's a very strong supporting community that's got them those titles, and that's the types of people that they hope to see out supporting them over the next 2 weeks. It's a lot of games.
Yeah.
8 days of games, so, a lot of softball. If you have missed some of it, probably a lot to watch in the next couple of days.
Okay, so a busy weekend. Thanks, Felicity. That's Felicity Reid with our sports there. Black Friday sales have kicked off with gusto as throngs of Kiwis keen to save money on their Christmas gifts hit the shops. So are people worried about overstimulating the economy with a looming recession? Reporter Amy Williams and camera operator Marika Habazi went to Sylvia Park to find out.
With COVID restrictions eased in 4 weeks till Christmas, today's sales attracted hordes of shoppers searching for a bargain. Fernanda Tapia had a special mission and a couple of $100 to spend.
I was looking for this teddy because Build-A Bear just opened up, so I just came. They have a 20% off, so that's what I came for.
Others, like Clinton Yankee, came with the wish list.
I'm looking for some clothes for myself, for my son, and a couple of toys at warehouse for my boy, for Christmas.
That's quite a list. What's your budget? What are you looking to spend?
My budget? I know, probably a couple hundred.
Official data shows retail sales haven't bounced back as strongly as expected, rising 5% in the 3 months to September compared to the same period last year, despite eased COVID restrictions. Not everyone was impressed with today's discounts. Chris Swannell was hoping to get his Christmas shopping started.
I'm still finding that some prices are still quite high, and even with the discounts, so a little bit inflated.
The Reserve Bank has asked people to rein in their spending to help curb inflation, but many people have flocked to Black Friday sales today. Many people I've spoken to say with Christmas just around the corner and COVID restrictions gone, now it's not the time to lock up their wallets. Clinton Yankee is among those loosening their purse strings.
It's been a rough couple of years for most people, and it's time to get out and enjoy it a little bit and get something nice for everyone.
Others are being more cautious.
I have been listening. I haven't spent a cent today yet. So that is a consideration. You have to be quite cautious about how you spend your money, and really conscious about Christmas coming up.
Perhaps the best gauge of spending intentions should come from the man in red. Santa Claus has returned from the North Pole for photo shoots in shopping malls and says Lego and Barbie dolls are still top of children's list. But labour pressures are hitting hard.
At the North Pole especially, with all the elves, they're giving me trouble now. They're having labour problems, and they don't want to work. And I say, well, you got to work. They should do, So
have you increased their wages?
No. They work for the joy of it, you see.
If you're wanting to check out the video version of that story, we'll put it on our webpage. It is 26 minutes to 6. Have you been out there thrashing the plastic, or did you heed the Reserve Bank Governor's warning to cool your jets when it comes to spending? Text us 2101 or email checkpoint@rnz.co.nz. It is time now to go to the business news. Ko taku hoa e Nāianei, ko Nona Peltier. It seems fitting that we're coming to business news off the back of that story, Nona. Consumer sentiment has slumped further. What are the numbers? Not those consumers that we were just watching, hearing around the mall.
No, actually, it could be those consumers.
Okay.
According to this, the confidence survey shows a 5-point drop to 80.7. That's the lowest level since June. Okay, so anything below 100 is pessimistic.
Yep.
So the numbers are dropping. We saw that there was a drop also in the number of people who were prepared to pay for a major appliance. And 16%, a net 16%, expected to be worse off. Okay, so a net 31% think it's a bad time to buy a household item, like a major one. And yet, that's not what we're seeing in these retail figures. No, the retail figures for the September quarter increased 4.9%. People were spending more on food, beverages, cafes, etc., bars, takeaways.
But it could be the lag, couldn't it? Between being told to tighten your belts.
Well, it could be a number of things. It could be that the year before we were locked down.
Yep.
And so it wouldn't be surprising that there'd be perhaps a very large increase. But also, there's more tourists in town and, across the country, so that's making a difference. But yet, spending has not declined, all right? So no matter what the Reserve Bank governor is saying, people are still going out and spending their money. So where they're saying we're really depressed about our situation, they're not really acting that way. And we just saw that in that video.
So what are they buying, Nona?
Well,
if they don't like the big ticket items, what are they buying?
Well, they're mostly eating in restaurants. They're having a good time, I think, is what they're mostly spending their money on. I was talking yesterday about AFT Pharmaceuticals and how their outlook's pretty positive because people buy more pain relief when the economy's bad because it gives them a headache. Yeah.
And apparently lipstick too, if the GFC is anything.
Lipstick can always cheer you up, but not for everybody. Not for everyone. So anyway, look, for now, cash flow is okay for households, but it's definitely forecast to shrink just as the inflation continues to rise and those interest rates too.
Okay, so what numbers have you got for us from the market today?
Well, the market was a little bit more punchy today. It rose 0.5%. That's the NZX Top 50 Index. It was a 61-point gain to 11,383. And we're seeing a more positive tone right across the region and also in the major markets, Wall Street, etc. And one of the reasons is, we touched on briefly yesterday, was the U.S. Federal Reserve. They had a meeting this week, and the sentiment coming out of there is, well, maybe we don't have to be as, sharp on those interest rate hikes. Perhaps things are slowing down anyway. And that made the market take a bit of a pause, think, okay, maybe interest rates won't go up that high. And so that's really helping our Kiwi. We're steady at 62.7 US cents, 92.5 Australian, and 51.7 British pence.
Thank you, Nona. Ka kite, Nona Peltier there with Business News. It is 23 minutes to 6 and you're with Checkpoint on RNZ National. We're going to get to some of your feedback now. A lot of you getting in touch around healthcare. This person says, I'm a senior experienced registered nurse of 40 years. Labor have done nothing to help the nursing shortage. They can if they want to. Immigration prevent foreign registered nurses coming in with families. There are so many barriers to getting overseas nurses here. The few that can get in usually go to elderly care where they quickly leave for DHBs where the salaries are so much better. This is exhausting for the skeleton staffs running the health system. They can't go on much longer. There is plenty of money for other things. Now it isn't just about money but about getting resources in from overseas now. capital letters, says Patricia. On GP enrolments, we went to a West Auckland GP clinic that hasn't enrolled new patients for 2.5 years. This person again says it sounds like it's time to open the borders and let in the 50k much needed migrant workers. Mike says always easy to get to see my GP, often on the same day, never more than 2 to 3 days wait. That would be unusual. I think you're lucky, Mike. In Taupō, someone has got in touch to say generally waiting for a GP appointment 4 to 6 weeks. Wowza, let's hope it's not an urgent thing that you've got. Someone else says let people without a GP suffer because otherwise the lucky ones will have to wait longer. How does this sit with medical ethics experts, says Paul. Kātatin Wairarapa, we have to wait up to a month for regular visits, this listener says. Even triage and acute care is difficult to get in. Nurses are leaving the profession, not a fit-for-purpose hospital in the Wairarapa, with long wait times also. And Linda has got in touch to say, we've been enrolled with our GP for around 12 years. Within the last 2 years, it has taken anything from 2 weeks to 6 weeks to get an appointment. If the problem is urgent, we're referred to an emergency medical facility attached to our local hospital, Whanganui. And unless one has a community services card, this facility has charged us almost twice our normal GP fees. And just before we move on, someone getting in touch about the death of the dairy worker. Dairy robberies, the solution, they say, they can become non-cash businesses, FPOS only. If all small retailers do that and it becomes widely known, then the temptation to rob them must be seriously diminished. Do keep your feedback coming. So text us 2101 Homai o Whakaro if you want to add to the conversation. And remember, Professor Michael Baker is here very soon and he's going to be talking about how to avoid COVID this Christmas. So it's the last call for your questions. Do get in touch, 2101 on text, or you can email us, checkpoint@rnz.co.nz. Let's go over to the headlines now. Ko marama anō tēnei.
Thank you, Lisa. Small businesses are planning a mass protest to demand the government offer them more protection following the killing of an Auckland dairy worker on Wednesday. The chair of the Dairy and Business Owners Group, Sunny Kushal, is organising a nationwide protest to be held after the funeral for Javak Patel. He says thousands of businesses will shut for a minimum of 2 hours as a mark of respect and protest. Medical specialists say there is frustration with the Health Minister's big picture long-term approach when the health workforce is struggling now. People at the Association of Salaried Medical Specialists annual conference have spoken of 10-hour waits in emergency departments, assessing patients in corridors and ambulances queued up on admission ramps. Andrew Little told the conference that change is coming. A leading public health advocate warns the country is at risk of another deadly measles outbreak, with vaccination rates for children dropping off dramatically in the last 2 years. Both the World Health Organization and the Centres for Disease Control and Prevention have issued alerts saying a record decline in measles vaccination rates and persistent large outbreaks present a global threat. And Ngāti Mutunga or Wharekuri on the Chatham Islands has marked an agreement in principle with the Crown on its Treaty of Waitangi settlement. The deal includes $13 million in financial redress. The iwi's lead negotiator says its relationship with the Crown has been fractured since the islands were annexed in 1842, and this is a chance for a fresh start. We'll have more news and weather at 6.
Ngā mihi. One thing that is probably not on anyone's Christmas wish list this year is COVID. But with the season for mixing and mingling upon us, it could be harder and harder to avoid first or second time round. Earlier this month, health officials warned summer cases could peak at more than 11,000 a day, with 100 hospitalisations each day too. And that would be similar to July numbers during the second wave of Omicron. So to help you avoid a Christmas COVID, we are joined by Otago University epidemiologist Professor Michael Baker. Kia ora.
Kia ora, Lisa.
Thank you for joining us. The questions are coming thick and fast, so let's see how many we can get through, and just give us a shout if they're not your area of expertise. Okay. Christmas means a lot of socialising. People are asking, Christmas work party, haven't been for a couple of years. Should I go this year? Is it safe?
You definitely should go, because I think it's so important to socialise, reconnect with your workmates and enjoy the festive season and so on. So I think that's really important. The big issue is trying to do it as safely as possible.
And so what's your recommendation then in terms of safety? What do you need to do?
Sure. Well, I think the main thing is to talk with those who are organising the party and make sure that they're aware of ventilation. And I think one of the things is to try and shift these events outdoors as much as possible to covered areas where there's good airflow. And there are lots of venues that have those sort of settings. I mean, that's the first thing. And then you can feel much more comfortable knowing that your risk is reduced. Now, if it's going to be a long evening with lots of people, and people, of course, are going to be eating and drinking, and they're going to take their masks off.
Yes.
So this is where, if it's a big event, everyone can get a rat test before they go. And that just gives you a lot more reassurance that you're not going to have infectious people there, or you're less likely to have infectious people there. So I think it should be made very clear that that's an expectation in those situations.
If you were hosting a party, Professor, would you say on the invite, please have a rat test before you turn up?
Yeah, well, I've actually had that experience recently for my wife's birthday, and we said you must get a rat test before you come. And there were 100 plus people in a well-ventilated hall, and as far as I know, no one got infected in that event.
You mentioned food, because that's the other follow-up here. Finger food and punch bowls, the whole sharing thing. Your thoughts?
Not a problem. This is a respiratory virus. It's spread by aerosols. As far as I know, there are no documented cases that have occurred from contaminated surfaces. And it's remarkable, early on in the pandemic, we were so worried about these surfaces, and it was in the end hygiene theatre that we were sterilising everything in sight. And it was unnecessary for this virus. It's good for other things, stopping other infections, but not this virus.
So we've learnt a bit more. Now, someone has got in touch saying they're just recovering from their second COVID infection, and they've had 4 vaccinations as an over 60, they say. How soon are you at risk again of infection, they're wondering?
Well, unfortunately, you're at risk quite soon, even within a month. So you have to start taking precautions very soon after you've recovered from an infection to avoid getting reinfected.
Gosh, that's depressing. So even though they've had it twice, is that the 30 days thing, Professor? Within 30 days, you should be really taking all the full precautions like your mask and what have you?
That's right. And there are people who've been infected in less than 30 days. So, but you have got obviously more antibodies after you've had an infection. But the way to get antibodies is from vaccinations and boosters, not from getting the virus if you can avoid it.
Okay. Someone else, MJ says, if you still test positive after 7 days isolating and you've had Paxlovid, can you still transmit the virus if you are still testing positive? You had the Paxlovid, you've done your 7 days isolation, but you're still getting the 2 lines. Are you still potentially going to be a person who's spreading it?
Yeah, you are still infectious if you're testing positive to a rat test. And that's one of the valuable features of that test. It's picking up, modest levels of virus. You actually need quite a bit of virus there for it to register a positive test. So generally, it correlates quite well if you're being infectious.
So should you then stay home longer if you're still returning the positive test? That's
right. And you remember with this virus, the original isolation period was 2 weeks. 10 days is pretty good. You probably don't have virus left after 10 days. But at 7 days, a quarter of people are still excreting the virus. At 5 days, it's 60% or more. So we can't shorten this period too much.
Okay. So is it worth, you mentioned vaccinations, and there's a couple of questions around this. Is it worth getting another shot if you're eligible for a booster? It's confusing when people talk about new strains not being covered. What is the best advice?
Yeah, look, get any booster you can and that you're eligible for. It will give you a lot of protection. At the moment, we still have a quarter of New Zealanders who are eligible for their 3rd dose or their first booster who haven't had it. And when you're getting to that 4th dose, the second booster, over 50% of people who are eligible are missing out on this. So this is a big gap that is really avoidable at the moment.
Okay, and another one from someone who has had COVID as well. 2 weeks ago, tested positive for COVID, had 3 days of fever, they said, aching joints, sore throat and headaches. That all sounds quite what everybody seems to get. Isolated for 8 days, they said, feeling okay now, fine. But they're obviously, well, super duper athletic. They're training for coast-to-coast race in mid-February, 10th race. They're wondering about how soon's too soon to going back to exercising. I imagine that's pretty hardcore exercising as well.
Yes, well, I think everyone knows the advice is to take it easy. And certainly people are saying wait from at least 2 weeks from the onset of your symptoms to start gentle exercising again. And of course, if you still have symptoms, you want to really take it easy and not get back into exercising until you're feeling like it. And then, again, just build up in a slow way.
This one sort of follows on. Emma's got in touch to say, is COVID infection accumulative? The more times you get it, the more likely you are to get long COVID, Emma is asking. Do we know anything about that?
Look, I think the starting point at the moment is that every time you get infected and reinfected, it has a similar effects. In other words, you're going to be ill. You run the risk of serious illness and also long COVID each time. It's not something that where the risk drops. The risk doesn't necessarily increase hugely. Over time, we might get a better sense of this. The good news is that vaccination decreases all of those risks, including long COVID, and also antivirals now we know decrease your risk of all these outcomes, negative outcomes, including long COVID.
I know you touched on this when you were mentioning immunity, but this is a specific question be good to get you to address. Our household has had someone in isolation for on and off for 3 months with a second wave of COVID infections. If one of us gets it again, is it better to try and spread it to everyone and get isolation over as a group?
No. Basically, you don't want to get this infection even once, and you certainly don't want to get it over and over again, because each time you have these negative consequences.
And this, what would you say to people, because there seems to be some talk about, who simply say they're not going to test no matter how bad they feel because they don't want to be stuck at home during the holiday season?
Well, you guess what I'm going to say about that. I mean, that is very irresponsible behaviour. If you don't want to test, you still have to isolate for at least a week. If you test negative but you've got very likely symptoms, particularly if you have a history of contact with other cases, assume you have this virus and don't go out and infect your workmates, and don't go to social events. No one will thank you for that.
Travel's going to be a big thing, so over this period of the year, and people are asking about that, air travel in particular, saying how much more riskier is that? Is it better to take a car trip or load the kids on the ferry rather than take a plane?
Yeah, well, look, I assume you have a lot more control of who's in the car with you if it's your car. A place like a ferry, I think, is generally a well-ventilated environment, and you can step outdoors and ensure you're in a place where there's good through ventilation. Now, with aeroplanes, the big problem is when you're getting on and off the plane, because once the plane is airborne, its ventilation system starts to kick in, and it's relatively efficient. So this is clearly a place where masks are useful.
So if you were getting over on a plane over the Christmas break, you would wear a mask, Professor?
Yes, I've just got off a flight today, and I wore a mask during the whole flight and getting on and off as well.
The interesting thing, though, is when you looked around the plane, were you on your own?
Not quite. I was in a minority, definitely.
Yeah. So aside from the mask, question about whether are there better seats than others on a plane in terms of spread of COVID, and I assume other airborne illnesses?
I'm sure that it does make a difference, but I don't think it's a significant difference. The main thing is, as I was saying, it's when you get on and off the plane is the biggest problem, because you are jostling often with lots of other people in a confined space with very little ventilation. So that's the time to focus on the mask rather than, it's still good to wear it during the flight, but, taking it off for a cup of tea or whatever you're doing is not a big deal, I don't think.
Okay, seeing as you are a mask wearer, someone is asking, how many times do you feel comfortable reusing an N95 mask? And do you know if they can be washed?
Yes, well, I think you can use them for many times. And as long as the mask is still fitting well, the elastic is still working, and it's comfortable, you can keep using it. And like most people now, I have a few of them, and I just kind of recycle them from one day to the next. But they can be used many times. In general, I wouldn't be washing them, but you can wash them in warm or hot water and dry them. But I don't think that's going to improve their performance as a rule.
Okay. So again, with Christmas shopping, people inside heaving shopping malls and supermarket too, people have noted more people in there at the moment. How high risk is that environment? You have mentioned that you wear a mask on a plane and have recommended it on transport, but what about those environments? Where's the list of where you would wear a mask?
Yes, I would certainly consider using a mask in a very tightly packed, poorly ventilated shopping situation. They're perhaps less critical in a big open mall where there's good ventilation and the density of people is not particularly high. But you're right, the Christmas rush means that you will be in situations, and this is where there's a risk, and this is where judgment's needed. I mean, you have to really look at just the obvious things, the number of people, the amount of space you're jammed into, whether there's a good flow of air, and how long you're there for. And obviously, this is where judgment is really important.
Do you think it would be easier? This is a question for me, Professor. Would it be easier if there was a mandate that made it clear about where people should wear masks? Would you like to see us go back to more mandated mask wearing?
Yes, well, look, the government has got that capacity to extend mask mandates if needed. They're only required in healthcare and aged care facilities at the moment. I would like to see them extended to public transport because people are in that environment for many hours every week, a lot of commuters. I think there is a case when we see the numbers tracking up, as they're doing at the moment, for extending it to some other indoor environments. But again, it's a balance now, I think.
And we're almost out of time, but people are curious, having tracked you. Have you had it yet? Why not? Are you a hermit?
A bit of all of the above. No, I haven't had it yet, and I think I've been very fortunate because I've had, obviously, family members and contacts who've had it. I'm fortunate in having a job where I don't have to be at work every day. When I am at work, our whole department has quite a tight policy on mask wearing. Some staff members have CO2 monitors so they can look at the level of CO2 in indoor offices. And when it gets up around 700 or 800, you open a door and you just see the level drop. And it's a great tool for because otherwise you are rebreathing people's air and or the expelled air. It's just an indicator of risk. And it seems to work very well. I'm not aware of any transmission in our workplace.
Fascinating. Thank you so much for joining us, Professor Michael Baker, who's apparently a unicorn when it comes to catching COVID as well. Hopefully there's some useful tips for you to use over the summer. 4 minutes to 6, kia mau tonu mai. Do stay with us. You're listening to Checkpoint on RNZ National. And to the US now for what's become one of America's most heartwarming Thanksgiving traditions. And it all started 7 years ago with a text sent to the wrong number. CNN's Brianna Whitney has the story.
They say you lose track of time when you're having fun.
What number year is this? 2022.
Year 7.
Yeah. Oh.
Year 7.
And as the years add up,
it's going to be bad when I get 30.
Wait till you get 65.
The more fun these two seem to have.
We even had an adventure. We went to Atlanta, Georgia at the beginning of the year and had a blast there. We were on a game show.
Wanda and Jamal have captured the world's hearts since 2016, when Wanda Dench accidentally sent a text to then-teenager Jamal Hinton for Thanksgiving dinner, thinking she texted her real grandson. That unexpectedly led to a tradition of them celebrating Thanksgiving together every single year since, with a friendship to boot.
I do know the first Thanksgiving he didn't bring anything over.
Wow, we're just throwing people under the bus. Golly.
This year, they're adding a new activity to the mix.
We thought we could bring pies to, everybody's Thanksgiving tomorrow.
Let's get to it.
Baking pumpkin pie.
I thought you said it'd be good no matter how I folded.
Well, I got to thinking they might burn underneath. I don't think I'm a good cook, but my husband said I was.
Wanda's husband, Lonnie, a staple at Thanksgiving, passing away in 2020 from COVID. On Thursday, they'll all have dinner at Jamal's girlfriend Michaela's family home, the last place Lonnie celebrated Thanksgiving with them. Even though he's gone, Lonnie's still part of changes in their lives this past year.
I got a tattoo, and this guy accompanied me because it was my first tattoo. It's 3 shooting stars, and they represent my husband, my mother, and my father, who are all in heaven right now.
Jamal growing up in front of our eyes from teenager to adult, adding a new title to his resume this year, coach.
5th grade, 6th grade basketball coach. I have some amazing kids on my team.
What's it like to be on the opposite side of that when in this story you started as the kid?
It's amazing. It's something that I never thought that I would do. I always looked up to my coaches. It's just great to know that there's kids out there that I'm helping.
And perhaps the biggest change, Wanda is moving a couple hours north to Prescott, Arizona.
It'll be bittersweet because I have wonderful memories of this house and all our Thanksgivings that we've had here.
Don't worry, they already have an answer to your question.
We already have, I guess we have year 8 planned out already.
8's going to be in my new house up in Prescott.
Yeah.
Yep.
I was going to say, what does this mean for the...
It means that I got a lot of driving on Thanksgiving next year.
Yeah.
These two always going the extra mile for each other because no matter differences in race, background, and generation.
My old-fashioned timer. I know you would use your phone.
I was going to say, you know your phone has a timer on it?
I know you're going to say that.
The only ingredient needed here.
Bam!
This is going to be perfect.
Is a whole lot of heart.
RNZ News at 6. Good evening, I'm Marama Tipole. Small businesses plan to send a message to the government about offering more protection to workers with a mass protest. It follows the fatal stabbing of a worker at the Rose Cottage Dairy in Sandringham on Wednesday night by a man who also stole the cash register. John T. Dine reports.
The nationwide protest will see thousands of dairies and small businesses close their shops for at least 2 hours. Business leaders say the time for talk is over and they are demanding action to help keep them safe. A Give a Little page has been created to fundraise for the family of 34-year-old Janak Patel and help with funeral arrangements. It has already raised $15,000. The New Zealand Indian Central Association is also calling on as many people to attend Janak Patel's funeral as possible. Meanwhile, the police are appealing to anyone who knows the attacker to come forward.
A Gore district councillor has rubbished claims from the district's new deputy mayor that a move to oust him is motivated by loyalty to the previous mayor. The town's new mayor, 23-year-old Ben Bill, has chosen second-term councillor Stuart McDonnell as his deputy. Mr Bell beat 6th-term incumbent Tracy Hicks by just 8 votes. The council has already turned down Mr Bell's request to have a full-time personal assistant, and now a majority of councillors want his deputy to go. Mr McDonnell says the move is motivated by loyalty to Mr Hicks. Councillor Neville Phillips says that's wrong.
My reasoning for signing this piece of paper is I want stability for the next 3 years, for the next triennium. I want the mayor to understand that it's not a personal thing. It's just about making sure that we're doing the best thing for the district.
Ben Bill is currently on leave. A leading public health advocate warns the country is at risk of another deadly measles outbreak, with vaccination rates for babies and toddlers dropping off dramatically in the last 2 years. Both the World Health Organization and the Centres for Disease Control and Prevention have issued alerts saying a record decline in measles vaccination rates and persistent large outbreaks present a global threat. Nikki Turner from the Immunisation Advisory Centre says vaccinations for 2-year-olds have dropped in the last year to just over 80%.
But even more alarming for our tamariki Māori, for our Māori kids, it has dropped off precipitously so that now only 2/3 of them are fully immunised for their measles vaccine by the age of 2. This is a real disaster for our country waiting to happen.
Dr Turner says measles is only a plane ride away. A community leader says the death of a swimmer found in Lake Wanaka earlier today has left residents shocked. Police responded to reports of a missing swimmer just before 7 o'clock last night. The National Dive Squad recovered a body from the lake this afternoon who is believed to be the swimmer. Wanaka Upper Clutha Community Board Chair Simon Telfer says the lake is known as a safe spot. The swimmer is reportedly a visiting South Korean man. Urgency has been lifted in Parliament ahead of the weekend. The House was put into urgency earlier this week to progress more than 20 bills, some through all stages, to make up for time lost after the death of the Queen. There was time allowed for Parliament to sit until midnight tonight and then possibly into tomorrow, but Leader of the House Chris Hipkins called time late this afternoon.
Can I thank members across the House for what has been a very big week for the Parliament. It is now time to pull up stumps. The government does not intend to progress further under urgency this afternoon, and so the House will next meet as normally scheduled at 2 p.m. on Tuesday, the 6th of December.
The ACT Party has criticised National and Labour MPs for not taking enough time to debate the legislation that's been going through the House. As urgency went into Friday, some MPs took extremely brief calls, which ACT says is not enough to provide the proper scrutiny. Former Prime Minister Scott Morrison has defended himself after a damning report into his actions in appointing himself to several ministries, sometimes without telling his ministers. A report has found his actions were corrosive to public trust, and it calls for immediate changes to make sure it cannot happen again. Current Prime Minister Anthony Albanese has vowed to make the changes, but Scott Morrison has taken to social media to say he was just trying to exercise his responsibilities to advance and protect Australia at all times. The Prime Minister's trip to the Chatham Islands today has included a Treaty of Waitangi settlement milestone for the local iwi. Jacinda Ardern was warmly welcomed to the islands with a pōwhiri this morning before officially opening the archipelago's first museum. She says it's an example of what the Crown hopes for in its treaty settlement with Ngāti Mutunga o Wharekauti, who secured an in-principle agreement as part of the trip.
We're actively working to reach settlement, but secondly, that we're supporting ways to preserve and share the unique history of this place as well.
Jacinda Ardern says the museum captures within its walls the unique history of the islands, the Moriori and Ngāti Mutunga. And 16 Māori artists from a range of backgrounds have been recognised in the country's premier Māori Art Awards. Ngā Taonga a Te Wakatoi recognises tohunga across all forms of visual and performing arts and have been awarded since 1986. Veteran visual artist Dame Robin White received the Supreme Award. Musician Rob Ruha, weavers Tina Wirihana and Veranoa Hitet and Kapahaka stalwart Te Aroha Painga are also among the winners. Other winners include painters, weavers, orators, navigators, musicians and Kapahaka performers. That's the news.
Tonight on Nights, it's Black Friday, but we're not going shopping. We're getting some fresh air instead with Country Life in its new home of 7 p.m. We're listening to some live music from SJD on Friday Night Live, getting a shortcut for our weekend viewing with Dan Slevin, and we're inviting Finn Johansson to hit us with some new music. It's all on Nights with Karen Hay after the news at 7 on RNZ National.
This is RNZ National on air, online and on demand. Back to Lisa Owen and Checkpoint in a minute. But right now, the short forecast from Met Service to midnight Saturday for Northland. A few showers, possibly heavy. For Auckland, fine apart from isolated evening showers. Waikato to Whanganui, including the central high country. Cloudy periods with scattered showers, easing for a time tonight. Manawatu to Wellington, mainly fine today with isolated showers. Cloudy periods tomorrow with showers north of Kapiti Coast. Bay of Plenty, Gisborne, Hawke's Bay, Wairarapa, also Marlborough and Nelson. Fine apart from isolated evening showers. For Bulla and Westland, isolated showers today, rain for tomorrow, easing in Bulla and South Westland in the evening. Canterbury, partly cloudy, isolated evening showers, possibly heavy and thundery in the south tomorrow. For Otago, Southland and Fiordland, occasional showers, possibly heavy, easing this evening, and showers returning tomorrow, possibly heavy in Otago later. And for the Chatham Islands, occasional showers, some heavy and possibly thundery until this evening, mainly fine for tomorrow. It's 7 minutes past 6.
Kia ora rama. No mai, hoki mai. This is Checkpoint, ko Lisa Owen tēnei. It's a new era for Aotearoa's most remote population, the Chatham Islands. One of its iwi, Ngāti Mutuna or Whare Kauri, has struck an agreement in principle for a treaty settlement with the Crown. The milestone came during Prime Minister Jacinda Ardern's first trip to the Chathams to open the archipelago's very own museum. Our political reporter Annika Smith filed this story from the easternmost point of New Zealand.
The Prime Minister warmly welcomed to the Chatham Islands, dozens of locals turning out to see Jacinda Ardern open their brand new museum.
Oh, I think it's a very significant occasion.
It's lovely. Just awesome to have her. Awesome to have her actually here.
The museum is the culmination of decades of work, expanding on what started as a makeshift display in the Waitangi store in 1971. One of its co-chairs, Jocelyn Powell, says it's a special landmark that reflects the island's people.
I think it's become a real Chatham Island museum now, rather than something that might reflect the mainland.
It poured with rain on the drought-stricken islands during the Prime Minister's visit. So much, even local cat Angus, a beloved Chatham's character, sought shelter with her under the gazebos. Even so, spirits were high. Ms Ardern excited to open the building on her first trip to the archipelago.
This is a really significant opportunity to be here, to finally talk directly with those locals who have been advocating for a number of the things that we've been able to make some progress on today.
Of significance during today's trip was the marking of an agreement in principle for a treaty settlement between the Crown and Ngāti Mutunga o Whare Kauri. It includes financial redress of $13 million and another $3 million towards cultural investment, most of which will go towards a new pa site on the islands. Ngāti Mutunga's lead negotiator, Tom McClurg, says it marks a new era for the Chathams, whose relationship with the Crown has been fractious since it was annexed in 1842.
In many ways, the treaty relationship has never recovered from that poor start. So this is a chance to reset the whole relationship between the government and Ngāti Mutunga people here, and we look forward to a new era.
The Chathams have been hard hit by drought conditions in recent years. Emergency Management Minister Kieran McAnulty was also there today to announce a $500,000 investment to bolster water security. It's estimated to secure reliable and safe drinking water for roughly 20% of the households on the Chathams. Mr McAnulty says it will make a big difference.
It's about as remote as you can get, as isolated as you can get, and when you've got situations where historically they've been able to access bores but they now dry up in the drought. We've got members of the community here regularly purchasing water from Christchurch. It just goes to show that's not sustainable. So what is essentially a relatively small investment is going to make a massive difference.
The $500,000 program will support households identified as most at risk from increasing droughts. Ngāti Mutunga's treaty settlement is expected to be formally signed next year.
Annika Smith with that report. Invercargill is making a pitch to young people in the city and trying to woo more to come and live there. Most of those around the council table are over the age of 50, so they've set up a pop-up kiosk today to find out what those aged 18 to 30 want for their city. Tess Brunton was there.
Invercargill City Mayor Nobby Clark admits the council hasn't done enough to engage with young people in the past, but he says they're trying to be more proactive.
We've got a lot of people around the council table that are 50 plus. How do we know what the next generation of people actually want? So we thought we'd do something in the mall. There's a lot of shopping going on today, being Black Friday, and we'd actually ask people between 18 and 30 what they actually wanted to see in the city, whether they've been somewhere else and found that there's better elsewhere, and whether there are things that we could adopt.
Izzy, 23, moved down from Dunedin at the start of the year for work and says Invercargill is getting better for young people.
I think when I came down there wasn't so much, but now that the mall and things have opened, there's just places to get out and about in the town rather than just hanging out at home.
19-year-old Hannah has lived in Invercargill most of her life.
Yeah, there's lots of good things about it, but it's also cool to see it changing. I'm loving like the new mall and all that sort of stuff, just seeing it grow a bit.
And she has a few changes in mind.
Probably the biggest thing that stands out for me is the lack of mental health services, so I'd really love to see that changed. And then probably also just more like events and stuff happening around the city would be pretty cool.
But 17-year-old Rianne wants to leave. What do you like about Invercargill?
Oh, nothing. I want to get out of here.
Why is that?
Because it's so boring, there's like nothing to do compared to other places.
And 16-year-old Charlotte, who's already packing her bags, has a few thoughts.
More activities, like ice skating is like a full 30-40 minutes away. How are teenagers going to get there? Like, I think we need more activities for teenagers to do, because like they wonder why like teenagers are like turning towards like violence and stuff, because there's nothing for us to do. All we do is sit at home and watch Netflix, and that's boring. We want to go out, we want to go see stuff.
22-year-old Hannah moved to Christchurch recently for better job opportunities, but is visiting back home.
When I was growing up, I always wanted to be somewhere to be a space for kids or like teenagers to hang out, because I feel like there's not really any specific spaces, like they end up at McDonald's or something like that, or the parks, but there's not really a teen central space, which I guess the new mall might be.
Nobby Clark would love to see more young people return to the city after studying or stay to study, but he admits there's not much for them at the moment.
At the moment they tend to hoon around town in cars and sober driver, and the rest are all drinking in the back, but there doesn't seem a lot else. We've got quite a good nightlife in Invercargill around restaurants and bands and restaurants, but they're not pitched at that age bracket.
The Mayor's promising to take all feedback on board and will meet with students at the local Southern Institute of Technology in the new year.
Tess Brunton reporting, and it's almost 6:15. You're with Checkpoint on RNZ National. To Australia, where the former Prime Minister has been dealt a major serve. A report into Scott Morrison's secret self-appointed ministerial roles has found his actions have been corrosive to trust in government. Mr Morrison had secretly added 5 roles to his leadership during the coronavirus pandemic. When the revelations were made public, he blamed the COVID pandemic.
These were extraordinary times in which I had the great honour and privilege to serve as Prime Minister. No Prime Minister, I think, has faced the same combination of circumstances. It was a very extraordinary time that tested every sinew and fabric of governments, not just at a federal level, but at a state level as well.
Current Prime Minister Anthony Albanese didn't see it that way, describing today's report as scathing of Mr Morrison's behaviour.
The actions of the former Prime Minister were extraordinary, they were unprecedented, and they were wrong. He's misled the Parliament every single day in which he stood there. We're shining sunlight on a shadow government that preferred to operate in darkness. A government that operated in a cult of secrecy and a culture of cover-up, which arrogantly dismissed scrutiny from the Parliament and the public as a mere inconvenience.
The inquiry found the lack of parliamentary accountability undermined responsible government. Australia is now planning to introduce rules to increase transparency in ministerial appointments. And staying in Australia, dress code, birthday suit and sunscreen. For the first time in Sydney's history, Bondi beachgoers will legally be able to hit the Golden Sands naked for a good cause. Renowned photographer Spencer Tunick will be snapping the butt-naked crowd as part of a campaign to raise awareness of skin cancer and sun safety. But don't worry, the sun won't quite be up when the magic happens. Organiser Scott Maggs from Skin Check Champions explains.
We just want to put up a massive lightning rod, I suppose, for the issue of skin cancer globally. In Australia this week is National Skin Cancer Action Week, and this is kind of like a pinnacle activation, I suppose, to just get everyone to focus on their skin, and especially as we're coming into summer down under here, we really need to kind of look after ourselves and each other and learn what to look for and to get a skin check.
It is a nasty disease. How many people over there die a year from melanoma?
I think it's 2,500 a year, which is like one person every 5 hours. It's horrendous.
So the photo, talk me through what the plan is for that.
So we want 2,500 people to represent how many people are killed by skin cancer every year. And basically, yeah, we've teamed up with Spencer Tunick, who is an incredible kind of nude installation photographer. With some opera happening outside. Yeah, and basically he's travelling down from New York, and he's shot all around the world at the United Nations, Times Square, and the last time he was at Sydney Opera House with 5,500 people. And thankfully he's doing a shoot with us for skin cancer, which is amazing. It's what he works with as an artist, and we're honoured to have him down.
So the dress code for tomorrow is?
It's first in, best undressed. Basically, yeah, we really want to create an iconic moment at sunrise, and we're inviting people to come down well before sunrise so we can get everyone set up and derobed and in position to kind of greet the sun as it comes up just before summer. And we want everyone to kind of have in their mind that we can be the generation that can end skin cancer and can be responsible and know the dangers and know how to, treat the sun with respect because it's such a deadly disease and people shouldn't be dying from it.
So the call time would be what then? If you want them there just in time for sunrise and they all need to be ready, in the right headspace, what are we talking here?
Well, it's been a contentious issue. So we initially had it as 3 o'clock call time, which is very, very
3
early,
a.m.
and it has been quite. Yeah, and we've been doing lots of scouting missions over the last couple of weeks, and it's been very brisk. So with everyone's a lot of people's self-esteems on the line here, we kind of wanted to move it a little bit later. So 3:30 now it is, and hopefully we can get everyone down there and in place for around 4:30.
It's personal for you, this, isn't it?
Yeah, so one of my best mates from college, he was killed by skin cancer at the age of 26. And it was just terrible watching what happened to him and how it affected us and his family. And, no one should have to go out like that. It was just so hard to deal with. And I don't want to see that happen again to anyone. So that's why we started this charity, and our sole focus is to improve access and awareness to early detection. We think getting a skin check is such a vital thing to do for everyone, and to make it a yearly routine. And while you're in there, you need to learn what to look for and why it's important to look after your skin with, sun cream, hat, glasses, etc., and know the UV and all that kind of stuff. So, yeah, we just want everyone kind of watching and listening to this to get checked and learn that we can be better in the sun.
It sounds like a great cause, and I hope you get a fantastic photo out of it. Are you getting your kit off, Scott?
I'd feel bad if I convinced, 4,000 people to get the gear off and not myself. I think hopefully if it all is running smoothly, I'll hopefully kind of sneak in, through the side and be part of it. And everyone that I've spoken to who's done this before has just said it's one of the most amazing human moments that they've ever experienced. And it's such a great leveler. And people have, met people that they've ended up marrying and having kids with. And it's just an amazing experience that you don't get to have, ever really in your lifetime. So, and registrations are still open if you know anyone in Sydney. But I'm definitely really excited to take part.
Before you go, have you checked the temperature for the morning? What is it?
It's actually looking really good. It's beautiful down here at the moment. But yeah, we were out just before, and the sun has really got a lot of sting about it.
Yeah.
It's really hot. So thankfully we're doing this at sunrise, and we're giving sunscreen to everyone. And we're also doing free skin checks down here all week. So we've really got you covered from all angles. But fingers crossed the weather is fantastic and we create something really amazing.
And that's Scott Maggs from Skin Check Champions, and everyone who takes part in the shoot gets a copy of the photo too. World Cup favourites Brazil have opened their campaign with a 2-0 victory over Serbia. All 32 countries at the Cup in Qatar have now played in their first match. And while teams like Spain, England and Brazil have looked impressive, other football giants like Germany and Argentina have stumbled against unexpected opposition. But perhaps no team has such fervent fans as Brazil. The BBC's Wendy Urquhart reports.
Brazilians are football crazy and the World Cup is their holy grail. So much so that kids get sent home from school 2 hours before the match gets underway so that they can enjoy it too. Brazil have won the Cup 5 times, which is more than any other country, and they're determined to take home the trophy from Qatar. Back home, support for the team is brimming over, and in some places the party has already started. Men, women and children have been decorating what are known as the World Cup streets in the city of Manaus in fluorescent colours.
I am a designer, and this is very pleasant. You form a bond with your neighbours, and friendships are strengthened.
We're all working to give energy to our team and for Brazil to be champions.
I am happy to be painting the street and decorating it for the World Cup.
Almost every inch of the pavements and walls have been covered with art and cartoons. Enormous flags are hanging throughout the city. And of course, there are pictures of Brazilian football legend Pelé absolutely everywhere. Every time the World Cup gets underway, thousands of fans flock to these famous streets to soak up the atmosphere and watch the games on enormous TV screens. Brazil are certainly not invincible. In 2018, they were knocked out in the quarter-finals, and 4 years earlier, Germany thrashed them 7-1 in the semi-finals. They are one of the teams tipped to win the 22 World Cup, but then so were Argentina and Germany.
It's a special anniversary for 67-year-old Sandy Law this week. She had a heart transplant 40 years ago. It's believed no one else in the world has lived so long with a transplanted heart. In fact, the UK woman has had a second heart transplant in 2005. Sandy took the BBC's Evan Davis back to 1982 when she first had the operation.
On one of my many trips when my heart went wrong, they couldn't put me into the intensive care unit where they normally do the cardiac. So I went on to the cardiac surgery ward. I met a surgeon called Mr. Clark, and he came along and he asked, had I had any investigations done? And I said, well, no, but they were a lot when I was a child. And he said, well, would you mind if I got in touch with Mr. English for you? And I said, you mean transplant Mr. English? And he said, yes. I said, well, of course, because my outlook was I hadn't got any. I mean, it was just literally I'd been told the next attack could be the one that finished me off.
So it was really just because you were in that ward that you actually had that conversation that led to getting a transplant?
Yeah, because, I mean, subsequent to me having the operation, and I went back to see my own cardiologist at Queen Elizabeth. He was very, very nice about it, but he said he couldn't continue to treat me because ethically he felt that the operation was wrong and that he would never have recommended that for me. It was experimental because I was only the 12th person to go onto a drug called cyclosporin, which is what actually improved the odds of life expectancy when you had a transplant. It dealt with the rejection side. It was all totally new stuff.
What was your prognosis without the transplant? And what did you think the prognosis, and I really mean how long did you think you would have with the transplant?
Right, from about age 16 or 17, I would only live till about 30, 32. When I had the transplant done, Mr. English said to me, he said, well, if you wake up, we can give you a month. This is like after the operation. If you get a month, you might get 6 months. If you get 6 months, you might get a year. You even might get 5 years. And I've got 40 years. Truly, they didn't know. There were no guarantees whatsoever. I mean, it was so new that the NHS itself, they would not pay for the operations.
Now, there is a sad side to this story, Sandy, isn't there? Tell me about your family.
I've got no siblings because when I was born, that's when the disease was discovered and my mum was told to have no children. But I've got cousins and aunties that had the disease and basically none of them are left. I'm the only one in my entire family that had a heart transplant.
We should say you have had the second transplant as well. Now, tell us about that.
Yes, a transplant isn't a forever cure. The life expectancy they give to you surviving with a transplant is about 15 years. My first transplant failed 2003, and then in 2005 I got the second one.
How's that holding up?
That's brilliant. I'm wonderful. I'm not as fit as an athlete, but for me, I can do more than most folk my age. I'm so lucky to be alive. It's like I keep winning the lottery every day I wake up.
Sandy Law there talking to the BBC's Evan Davis. Pretty remarkable story. They say cats have 9 lives, but here's a story about a moggy who's lived just one for a very long time. The former stray kitten has been lazing in the Liverpool sunshine since 1995. That's right, she's nearly 27 years old. CNN's Steve Nans has the story.
Vicky Green was looking to adopt a senior cat when she saw Flossie on an adoption site. What she didn't know was just how special this cat truly was.
She's been awarded for currently being the oldest living cat in the world, and she is 26 years old.
26 years and 329 days, that is. That's the human equivalent of 120 years. The sassy senior came into Green's life after her owners passed away. Now, in a new home, this Guinness World Record holder can enjoy her extended twilight years surrounded by love and getting pampered.
I adopted her on the sort of basis that this is her retirement home and she gets whatever she wants.
27-year-old cat. I find it hard to believe. That is all we've got time for. Now, the late news team is going to keep you updated throughout the night. Just an update on the cricket. The Black Caps will be chasing 307 to win against India. A few of you got in touch about the Black Friday sales. If you don't need it, it's not a bargain, says Valerie. And this person says, I went shopping today, got pooed on by a bird, went home early. That sounds like a deal. Don't forget, you can check us out on Spotify or wherever you get your podcast from if you want to listen back to anything. Do have a fantastic weekend. Kia pai tōpō. We'll see you next week.
RNZ News. Good evening. It's 6:30. The police cordon around an Auckland dairy where a worker was killed on Wednesday has been taken down. Urgency has been lifted in Parliament ahead of the weekend. The House was put into urgency to progress more than 20 bills to make up for time lost after the death of the Queen. A victims advocate who is supporting families through an inquest into the 2018 rape and murder of Nicole Tuxford says there are obvious holes in how corrections manages high-risk offenders. Auckland University of Technology is making 170 academic staff redundant due to the funding hit from the lack of international students. And after a poll of Twitter users, its owner Elon Musk says the platform will restore some suspended accounts that had not broken the law. We'll have more news and weather at 7. It's 6:30. Talawhalawa o loo ingo o marama ti pole. You're listening to Trending Now. Good evening. And I thought, wow, I might just start off our little half-hour segment here with this amazing artist that I heard this afternoon on Jessie Mulligan's show for New Zealand Live. It was Arahi. Here's a snippet from some of that gold.
Would you like to begin by playing the final song on your EP? Sure. The EP is called Revelator, by the way, if you want to look it up this weekend. And this is My Baby's Like a Hurricane.
You head east and tell me west. I guess that means I should stop searching. Find a place on my own. These are the things I should start planning. I don't know if you get my letters anymore. I just write them, throw them to the wind. like I've been here before. Don't think I'll ever come this way again. My baby's like a hurricane blowing through the city of my soul. My baby's like a